Good afternoon, sir. My name is Ahmad Abubakar Musa with an ID number CPS/24/MHE/0006. I will be presenting a topic with a title stroke. Stroke occurs when a blood vessel in the brain ruptures or bleeds, or when there is blockage in blood vessel to the reaching brain tissue. People who have stroke, oxygen, brain cell and tissue become damaged and begin to die within minutes. So we have several signs of a stroke and symptoms. Among the symptoms of stroke, we have paralysis, that is numbness or weakness in arm, face and leg, especially one side of the body. We have slow speech, that is confusion, disorientation, lack of responsiveness, sudden behavioral changes, especially increased agitation. We have dizziness, that is the body of the person will be so weakly. We have a causes of stroke. Strokes are classified into three types. We have ischemic, hemorrhagic, and transient ischemic attack. Ischemic stroke. During an ischemic stroke, arteries supplying blood to the brain narrow or become blocked. Blood clot or severely reduced blood flow to the brain cause this blockage. We have two types of blockage that occur in ischemic. We have cerebral embolism, which occur when a blood clot forms in another part of the body, often the heart or arteries in the upper chest and neck. And also we have cerebral thrombosis. Cerebral thrombosis occur when a blood clot or develop at the fatty part within blood vessels. The second one is hemorrhagic stroke. Hemorrhagic stroke happens when an artery in brains occur or leaks blood. That is, the blood will leaks and leave its main channel. The blood from the artery characterizes excess pressure in skull and swell, damaging brain cells. And hemorrhagic stroke is categorized into two, which are intracerebral hemorrhagic and subarachnoid hemorrhagic. The intracerebral hemorrhagic, this occurs in most common type of hemorrhagic stroke. It happens when tissue surrounding the brain filled with blood after artery burst. Second one is subarachnoid hemorrhage. It's less common in people, especially the younger ones. It occurs when bleeding in area between the brain and tissue that cover it. The third one is transient ischemic attack. It occurs when blood flow to the brain is blocked temporarily. Symptoms similar to those of full stroke. However, they typically disappear after a few minutes or hours when the blockage moves and blood flow is restored. Risk factors that is associated with stroke. We have several risk factors associated to stroke. One, we have unbalanced diet height in salt. That is unsaturated and trans fat and cholesterol. Another one, as a result of physical inactivity, heavy alcohol use, tobacco use, family history, that is genetic, or stroke. We have complications of stroke. There are so many conditions that led to this stroke. Number one, we have seizures, that is neurological disorder, loss of bladder and bowel control, problem with speech and swallowing, cognitive impairment including dementia. We have shoulder pain, that is bed sores from the outer part of the body. How to prevent stroke? There are several prevention mechanisms geared toward preventing stroke. One, quit smoking, that is to leave smoking or abstain from smoking. 2, limit alcohol use. 3, keep a moderate weight. Third, that is regular checkup. Frequent talk with a doctor about how often to get checkup for blood pressure, cholesterol, and any other conditions. In conclusion, nutrition is one of the most critical modifiable factors influencing stroke risk and recovery. Poor diet promotes underlying strokes, which triggers like high blood pressure, cholesterol, while balanced diet protects the brain. Conversely, Post-stroke condition will be taken care with proper nutrition is a vital way to prevent nutrition and accelerate physical and neurological recovery. Thank you for listening.